I want to welcome you to the Morton Plant Hospital Spine Program.
My name is Jennifer. I am the Neuro-Ortho Nurse Navigator. A nurse navigator is a registered nurse who will help coordinate your care and guide you and your family during your hospital stay to assure a positive experience. I will be rounding on you daily while you are here. We are pleased you have chosen our facility for your spine surgery. Our goal is to return you to the best health as soon as possible. There's a lot to think about before surgery. Today, we're going to provide you with information to help you become familiar with the process involved with your surgery and hospitalization.
If you were provided a spine book, it might be helpful to reference during this presentation.
I'm going to talk about what to expect from the day of your surgery until the day of discharge. We hope this will answer your questions and reassure you about your spine surgery. Learning as much as possible will help you play a more active role in your recovery. If you turn to page 5 in your book, you will meet the rest of your spine team. As you can see, there will be many people involved in your care. Just to point out a few things, the licensed staff RN and LPNs wear white or royal blue, and the PCT who works under the direction of the RN or LPN wear dark green scrubs. The PCT is responsible for taking your vital signs and assisting you with activities such as bathing or toileting. Members of your team may also include physical therapists, occupational therapists, and the hospital care coordinators or social service specialists. Here are some housekeeping updates.
Morton Plant Hospital is promoting a healthy lifestyle.
Please, no smoking on campus. If you smoke, you might want to consider stopping prior to surgery. If you feel you will need a nicotine patch for your stay, please notify your surgeon. As the coronavirus infection rate continues to grow, BayCare Health System is closing patient visitations at its hospitals to safeguard the health of patients, team members, physicians, and the community. Your hospital staff will be wearing a mask during all patient care. Masks will be provided to patients for any activity outside of their rooms. Your spine is one of the most important parts of your body. It gives your body structure and support. It allows you to move about freely and to bend with flexibility. The spine is also designed to protect your spinal cord. The spinal cord is a column of nerves that connects your brain to the rest of your body, allowing you to control your movements. Without a spinal cord, you could not move any part of your body and your organs could not function. The spine is made of 24 bones called vertebrae. Ligaments and muscles connect these bones together to form the spinal column. The spinal column holds and protects the spinal cord, which is a bundle of nerves that send signals to other parts of the body. The many muscles that connect to the spine help support the upright posture of the spine and move the spine. The cervical spine is made up of the first 7 vertebrae in the spine. It starts just below the skull and ends just above the thoracic spine. The thoracic spine is made of the middle 12 vertebrae. The lowest part of the spine is called the lumbar spine. The area usually has 5 vertebrae. However, sometimes people are born with the 6th vertebrae in the lumbar region. The base of your spine, called the sacrum, is a group of specialized vertebrae that connect the spine to the pelvis. Let's take a closer look at the important structures of the spine. The vertebrae is the bony segment of the spine. In between the vertebrae is the disc. It consists of an annulus and a nucleus. The annulus is the tough, fibrous covering, and the nucleus is the soft, jelly-like substance in the center of the annulus. The foramina is the opening between the vertebrae where the nerves exit. There are many different conditions or problems that can occur in the spine. Regardless of the type of condition, most patients experience pain or difficulty performing basic daily activities in life, such as walking, sitting, or sleeping. There are many types of surgical procedures used to correct or repair problems that you may have with your spine. It is important that you are well informed about your surgery. Each surgery is different, and your surgeon will determine the best surgical technique based upon your condition. Page 10 and 11 discusses the many types of spine surgeries. No surgical procedure can take place without us first taking a good look at your overall health. In order for your surgeon to do his or her job to the best of their ability, your surgeon needs to know about your medical history. Your surgeon or primary care physician will perform a pre-op physical to ensure that you are healthy enough to undergo your spine surgery. If you have any cardiac history, they will also have you follow up with your cardiologist to get a cardiac clearance before surgery. You will have a pre-admission testing appointment prior to surgery. At this appointment, they will instruct you to stop taking certain vitamins or medications 7 to 10 days prior to your surgery. You cannot take ibuprofen, Aleve, Advil, or Motrin 7 to 10 days prior to surgery. Tylenol, however, is fine to take up until the day of your surgery. If you take a prescribed blood thinner like Coumadin, Pradaxa, Plavix, or Xarelto, you will receive special instructions on when this medication needs to be stopped and when it's safe to resume. You will also be provided with a soap called Dynahex Cleanse at your appointment. You will be instructed to wash with this soap 5 days prior to surgery. Please do not be concerned if you are unable to use the soap for the full 5 days. We have special medicated wipes that will be provided with instructions the day of surgery. The day of your surgery, do not apply any lotions, creams, deodorants, or makeup. The day before surgery, you will be also instructed to have nothing to eat or drink after midnight. Please note that your surgery can be delayed if you do not follow these instructions. If you are told to take medications the day of surgery, take with just a small sip of water. Healthcare benefits are constantly changing. It is important for you to understand your benefits before undergoing your surgery. Call your insurance provider to find out exactly what your plan does and does not cover. An important note, please report any changes in your physical condition to your physician. A number of problems may require the postponement of your surgery. These include a sore throat, a cold, a fever, dental problems, difficulty urinating, and skin conditions such as rashes or abrasions. If you have any questions about whether you are healthy enough to undergo surgery, please ask a member of your healthcare team.
An advanced directive
Gives a person of your choice the power to act on your behalf during any medical emergency you may suffer. This document is used to ensure that your wishes are followed even if you are no longer able to communicate them yourself.
If you already have an advance directive completed,
Please bring a copy to the hospital so it can become part of your records. For more information and available forms, you can visit baycare.org/advance directive. If you turn to page 18 in the spine book, you will find a checklist of ideas to prepare your home for your return after surgery. It is important to pick up throw rugs before surgery. Rugs can become a tripping hazard. It may also be helpful to move frequently used items to waist levels, grocery shop, and prepare meals ahead of time. You can look through the checklist for other suggestions. Let's talk about what to bring to the hospital. Bringing a few items from home may make your hospital stay more comfortable. The hospital does provide you with toiletries such as toothbrush, toothpaste, lotion, etc. But some people prefer to bring these items from home. If you wear dentures, we do have denture paste, but we do not have denture cleansing tabs. If you have sleep apnea and use a CPAP machine, it is important to bring your CPAP machine the day of surgery. You can give the machine to the nurse who admits you. It will be used in your post-anesthesia care unit and on the floor after surgery. We provide you with a hospital gown to wear during your hospital stay, but some people prefer to wear their own clothing. If you would like to bring clothes from home, make sure you bring clothing that is loose-fitting and comfortable. The hospital does have free Wi-Fi available, so if you would like to bring an electronic device such as a laptop, iPad, tablet, etc., you may. The hospital is not responsible for any lost or stolen items. Please leave all jewelry and valuables at home.
for your convenience, we offer meds to bed. This means we can deliver any prescription your surgeon writes to your bedside before you are discharged. You will need to bring a credit card, debit card, cash, or check so you have a form of payment for your copay.
Please do not bring any medications from home unless you have been told you take a medication that we do not carry in the hospital. During your hospital stay, the nurse will be providing you with medications from our inpatient pharmacy. Over the next few slides, we'll be discussing what to expect the day of surgery and your recovery. Keeping you safe is our top priority. We will be regularly asking you to identify yourself by stating your name and date of birth and comparing it to your identification armband. Your armband also contains a barcode. The barcode is scanned prior to administering any medications or collecting any labs to ensure the right patient receives the right treatment. One of our goals is to prevent the spread of infection to our patients. Your healthcare team will be wearing masks at all times and washing their hands with soap and water or using alcohol gel sanitizer before and after each patient encounter. If you have concerns that your healthcare provider has not washed his or her hands, please speak up and ask them to do so. We want to perform the right procedure on the right patient at the correct site every time. We will ask you to be involved in this process by identifying your surgical site and confirming the site with your surgeon.
Upon entering the hospital the day of surgery, you will report to the front desk and they will show you where to go from there. You will then be admitted to the pre-surgery area.
The nurse will ask your name and date of birth. A white hospital band will be put around your wrist. It has your name, surgeon's name, admission date, and birth date. If you are allergic to any food or medications, a red wristband will be applied to your wrist. Due to the fact that you will have anesthesia and pain medications, you will be considered a high fall risk. A yellow armband will be placed on your wrist to identify you as a fall risk patient. You will receive a red pair of non-skid slipper socks, and a bed alarm will be placed on your bed or chair. We ask that you call for assistance every time you need to get up from a chair or out of bed. A fall could be detrimental to your recovery. Our motto is call, don't fall. You will be assigned a room on the preoperative unit before surgery. We will be monitoring your temperature, heart rate, blood pressure, and respiratory rate. Your chart will be reviewed and any additional testing that needs to be done prior to surgery will take place. You will also be hooked to a heart monitor and given oxygen. On this unit, an IV will be started and you will receive fluids and medications through this line. You will also meet a few more members of your spine team. You will meet your anesthesiologist. An anesthesiologist or a certified registered nurse anesthetist will speak to you regarding your overall health and medical condition to determine which type of anesthesia is best for you. Anesthesia is a type of medication that causes you to lose sensation, therefore you'll feel no pain after anesthesia is administered. After speaking with anesthesia, you will be required to sign a consent form before moving into surgery. Your surgeon may order neuromonitoring for your surgical procedure. However, not all procedures require neuromonitoring. Neuromonitoring is a process performed by a specialist called a neurophysiologist. Electrodes are placed on the scalp, arms, and legs. The neurophysiologist reads and documents your nerve signals during surgery and communicates these with your surgeon. If this device is used during your procedure, the neurophysiologist will meet with you in the preoperative holding room to discuss the procedure and have you sign consent. After surgery, you may find a piece of tape on your arm, behind your knees, or a spot that looks like a pinprick. At this time, and because of current COVID procedures, no visitors will be allowed. Normally, our tracking board provides updates to your family while waiting on site. At this time, your family will receive updates regarding your surgical procedure via telephone. After surgery, you will go to the post-anesthesia care unit until you are awake and stable. Your nurse will frequently assess your dressing or surgical site, vital signs, pain, and symptoms. When you are fully awake and medically stable, you will be transferred to one of the spine floors. You will be in the post-anesthesia care unit for about 1 to 2 hours or until your room is ready. Your family will be notified of your room number. Depending on the type of surgery you are having, you may be spending a night or two in the hospital. In this case, you will be assigned to a hospital bed on a medical surgical unit. If you are going home the same day of surgery, you will move to what we call Phase 2 and be discharged home when you are medically stable. Upon arrival to the medical floor, the nurse will frequently assess and monitor your progress throughout your stay. You will continue to have an IV and be encouraged to drink fluids. The IV fluids will be discontinued when you are able to drink enough. You may have a catheter in your bladder, which is to monitor your urine. Typically, this is removed the morning after surgery. Sometimes a drain is placed in the surgical wound after surgery to drain excess fluid. This will be removed when there is decreased drainage.
A large whiteboard will be at the foot of your bed with your nurse and patient care tech names and hospital phone numbers on it.
All nursing staff carry phones. If you need anything, feel free to push your call button or call them directly from your hospital room phone. The whiteboard also contains the names of your pain medications and the times your pain medications are available. After surgery, you will be given small sips of water and ice chips. Depending on the type of surgery, your surgeon may want you to pass flatus prior to advancing to clear liquids. Once you can tolerate clear fluids without nausea or vomiting, you may begin to eat solid foods. Be sure to ask for a menu. Ordering food works like room service. You can find the room service number on your menu and dial from your hospital room telephone. If you are having neck surgery, you may have a little difficulty swallowing. We recommend ordering softer foods. Cold foods can also be comforting. Regardless of the type of surgery, it is important to choose foods that are high in protein and carbohydrates to promote the healing process. Prior to surgery, during your hospitalization, and post-operatively, you will be prone to constipation. The first way to prevent constipation is to eat a high-fiber diet and drink at least 6 8-ounce glasses of water each day. Walking is an important part of your recovery and will also help avoid constipation. This is a picture of a healthy plate. My plate illustrates the 5 food groups that are the building blocks for a healthy diet using a familiar image. Nutrients can be found in many sources and can contribute to a speedy recovery. Be sure to choose foods high in protein, zinc, fluids, calcium, iron, vitamin A, and vitamin C. In your hospital room, you will have access to Get Well Network on your TV. Get Well Network is an interactive patient education tool. Before you can get started, you will be required to watch a few short introduction videos. Once you have watched those videos, you will have access to the internet, patient education videos, a TV guide channel, and movies. You will find the controls for the Get Well Network and television on your call light. After surgery, your body is in a weakened state and at risk for certain complications. You will be instructed on techniques that help reduce the risks of these complications. In order to prevent pneumonia, you will be encouraged to take frequent deep breaths and use the incentive spirometer. An incentive spirometer is a medical device used by patients to help improve lung function after surgery and prevent pneumonia. It assists in lung expansion. Expanded lungs are healthy lungs. This slide demonstrates how to use the incentive spirometer. Begin by exhaling completely. Close your lips tightly around the mouthpiece. Inhale slowly and deeply, keeping the small blue ball between the 2 arrows. When you can't inhale anymore, hold your breath for 6 seconds. Exhale slowly. Do this 10 times every hour while awake. After surgery, you are also at risk for developing blood clots. In order to prevent this, we encourage early ambulation, frequent ankle pumps, and apply sequential compression devices while in bed. The sequential compression devices, or SCDs, are a device that lower your risk for blood clots. The SCDs are wraps that are placed on your legs with Velcro. These wraps alternate and gently squeeze your legs, helping circulate your blood, therefore reducing the risk of blood clots and pulmonary embolisms, or blood clots in your lung. Pain is a natural part of surgery and is something to be expected. Treating pain is an important part of your care and recovery. Only you can describe the type and degree of pain you are experiencing after surgery, and we will frequently be assessing the quality and intensity of your pain. We are committed to treating and managing each patient's pain after surgery. As a patient, we expect that you will assist your healthcare professional in assessing your pain. Your nurse will ask you to rate your pain on a 0 to 10 scale, 0 being no pain and 10 being the worst pain, a medical emergency. To help us measure your pain, we will ask you to rate pain before and after each dose of pain medication. The pain caused by surgery may be severe at first, but it will ease as your body heals. Be sure to report any pain to your doctor or nurse. All surgical pain may not be taken away, but you can expect to be made comfortable. Comfortable means about a 4 on a pain scale of 0 to 10. As stated, your pain medication names and times your pain medications are due will be written on the whiteboard. If you are not due for pain medications and are still experiencing an unacceptable level of pain, please let your care team know. We are able to make adjustments to your pain regimen if needed. Some tips for pain management. Discuss pain relief options with your healthcare professional to develop a pain management plan. Ask for pain relief when pain first begins and before any activity that might cause you pain, such as physical therapy. Tell your healthcare professional about any concerns you have about taking pain medications. There are different methods in which we give pain medications to treat your pain. We currently use a multimodal approach to pain management to reduce opioid consumption. Multimodal pain management includes the use of multiple medications and techniques, including opioids, non-opioids, and non-pharmacological therapies to control pain. IV dilaudid, morphine, and fentanyl are the most common pain medications used immediately after surgery for the first 12 to 24 hours. We will start you on oral medications as soon as you are able and use the IV medications as needed for breakthrough pain. Some commonly used pain pills after spine surgery include Norco or hydrocodone, Percocet, otherwise known as oxycodone, and tramadol. Muscle relaxants also work well in conjunction with your pain medications. The most common side effects for narcotics are the following: decreased respirations, drowsiness, nausea, vomiting, dizziness, constipation, rash, itching, dry mouth, and decreased appetite. Please report any of these to your nurse. Also, refer to the medication side effect sheet in your spine book on page 30 and 31. Out of the listed side effects, constipation seems to be the most common and can be a serious problem for some people. In order to prevent this side effect, you will be given a daily stool softener during your hospitalization. It is important to maintain your fluid intake to help the stool softeners work effectively. We also advise that you continue to take stool softeners following your discharge. You can buy these over the counter. Continue to take these stool softeners until you are weaned off the narcotics. While medications may help control some of your pain, there are other methods you will find helpful to assist in making you more relaxed and comfortable. These include ice, exercise, music, pet therapy, and distraction. See page 27 for other pain management treatments. To provide you with the best outcome, we have developed a care plan for your specific surgery. These care plans can be found in your spine book. Page 36 and 37 review neck surgery. And page 38 and 39 review back surgery. The picture shows a variety of cervical and lumbar braces that may be ordered for you by your physician. Not all procedures require a brace after surgery. Your physician will decide if a brace is required and which of the following braces you need based on your specific case. You will be educated on proper use of the brace, including when to wear the brace and the length of time the brace is to be worn. If your surgeon gives you a brace prior to surgery, please bring it to the hospital with you. Proper body mechanics are important, especially after spine surgery. After surgery, you will commonly hear no BLTS. This means do not bend at the waist. Do bend at the knees. Do not lift objects heavier than a gallon of milk, or 7 to 10 pounds. And do not twist your trunk. The only aerobic exercise prescribed by your surgeon immediately after surgery is walking. Page 41 talks about good body mechanics. Your therapy team and your nursing staff will continue to educate you on proper spine precautions throughout your stay. The majority of our patients go home independently after surgery. However, some patients will require a discharge home with home health care, and some patients may require a short-term rehab stay. A physical therapist will evaluate you after surgery and suggest a safe discharge plan that is based on your needs. Your surgeon will take these recommendations into consideration when determining a safe discharge plan. Physical therapy is going to focus on post-op exercises, ambulation, transfers, for example, on and off a toilet or in and out of bed, and performing stairs. Physical therapy may start on the same day you have surgery, depending on your surgeon and what time you arrive to the floor. You will have physical therapy sessions twice a day during your hospital stay. Your surgeon may also order occupational therapy postoperatively to help you learn to dress, bathe, and use the toilet while maintaining any special precautions after surgery. To ensure a safe recovery, you may need special equipment. This may include a reacher or a grabber that will allow you to access items stored above or below the waist. A walking aid, this can be a walker or a cane. A bedside commode, this is a raised toilet seat set in an enclosed aluminum stand. It can be used in any room or placed over your bathroom toilet. It gives you the extra lift, which can be helpful after surgery. Remember, you don't want to sit on anything too low. If you need an assistive device, the physical therapist will teach you how to properly use the equipment. If needed, your physician will place an order for your walker or bedside commode. If you already have a walker at home, you do not need to bring it to the hospital. We have walkers on the floor that you will use while you are here in the hospital. If you do not have a walker, we can order one while you are in the hospital, and it will be delivered to your hospital room before you are discharged. Medicare will cover 80% of your durable medical equipment. Please hold on to your durable medical equipment for at least 5 years. Medicare will only pay for a walker or assistive device once every 5 years. After surgery, you may need some assistive equipment for dressing and activities of daily living. We can order hip kits and reachers in the hospital, which can also be delivered to your room. As stated, our goal is to have you discharged home after your hospital stay. However, there may be occasions when you need to have further rehabilitation. Planning for discharge is important. We will work with you and your family to develop a discharge plan that will help you make discharge arrangements. Some patients may need help beyond what family and friends can provide. Home health workers can bridge that gap. These include physical and occupational therapists, home health aides, and nurses. Home health workers help you walk, regain strength, and complete daily activities. They also monitor your condition and safety. Some patients need more help than home health care can provide. They may need skilled nursing or rehabilitation centers. In a skilled nursing or rehabilitation center, you can continue your rehabilitation before returning home. Therapy helps you build strength and endurance with a goal of returning home as soon as possible. There are a number of places to choose from for skilled nursing care if needed. Our social worker and case coordinators will discuss options with you. When will you be discharged? A smooth and speedy recovery depends on you following the activities laid out by the healthcare professionals in your patient care plan. By strictly following this plan, you will have a better chance of leaving the hospital sooner for home or, if needed, a rehabilitation center. The type of procedure will determine your length of stay. Some patients go home the same day, and others may need a longer stay. Your surgeon or nurse navigator will review this with you. Goals to be met prior to discharge include up and walking around safely, eating without nausea or vomiting, pain controlled with oral pain medications, and having no difficulties urinating. Continuing infection prevention when you return home is important for your recovery. Some patients may have a simple dressing change. Be sure to wash your hands before and after caring for your surgical wound. Remember, do not apply lotions, creams, or ointments to your incision site. Be sure to use clean towels and washcloths with each shower. Change bed linens frequently. Do not allow animals to sleep in your bed, and wash your hands after touching animals. Do not pick or touch your incision. If you experience redness, pain, or drainage at the surgery site or develop a fever, call your surgeon immediately. Patients who smoke are at an increased risk of infection. Ask your doctor how you can quit. Diabetic patients with poor glucose control are also at an increased risk of infection. Be sure to follow your glucose levels closely. You will have access to the patient portal if you have provided the hospital with your email address. You will receive a link sent by the hospital. Please click on the link and you will be able to access your medical records. We always want to provide our patients with high-quality care. Please take a brief moment to fill out the hospital survey that may be mailed to you after surgery. To assist you in your plan of care, remember to bring your spine surgery book with you to the hospital. The spine program staff wish you a safe and rapid recovery. If you have any questions, please contact me. My card is located in the back of your spine book.